Cutting Edge Benefits podcast with our host, Tom Quigley of ClaimLinx. Tom, we have breaking news. We need a breaking news or the Muppet News Flash, which I've said before. We have breaking news. We've had a lot of breaking news in the last couple months on the podcast, but this is big. We were talking a couple weeks ago on the podcast about premiums going up for businesses. A little bit more of a raise than we thought. Let's see.
Yes. Let me show you one. This is a client, potential client, if they listen to me. And let me show you this. And their premiums are going from $62,000 to $95,000 with UnitedHealthcare. So want to hear the funniest part of this? Is I'll lower their rates overall to $25,000 if they listen to me.
Wow.
And I'll save me over $800,000. So think this through. If you look at the middle plan here, the same network as the other two, and you look at the rates and the out-of-pocket on this one, $6,500. The one to the right's $8,500, and the one on the left's $8,700. I did the math for them, and I said, if you covered their copays for them and gave them, they would have less out of pocket if they had a hospitalization or anything and surgeries, and you designed it the same way, you would save $180,000 off the premium off of what your people are choosing. And you could lower their copays, and you might pay back $25,000, $30,000, so your net savings is $150,000 just off of the middle plan. So everyone's doing this. This is hilarious. And it's sad, but they listen to me, they go to $25,000.
Unbelievable.
Yep.
I mean, and so why would it go to 25,000? Because you have the solution.
Because it's the solution. I would literally do it differently. Yeah. The insurance carrier here it's just hilarious. And the agents come back with, I don't want to reveal names or anything. That's why I kept it like that. But yeah, this company, I had another one and I offered the COO today. Actually yesterday, he said he wouldn't be interested in saving money. And I said to him, I want you to come on my podcast and explain why you're going to give the insurance companies thousands of dollars extra and hurt your employees because they will have to pay more and get less. And his HR director was like, you're going to listen to this. And now looks like they're going to listen. They're going to save about $250,000 for 25 people.
Wow. But see, you were straight with them.
Yeah.
By calling them out to come on your podcast, saying you want to, because, and the thing is, you have to do your solution because it's just going to be unmanageable for a company. If a company's going to know they're going up 40%, that's a huge loss right to start 2026.
52% on the one I showed you. Yeah.
Ridiculous.
Yeah. So I just sit there and I'm like, I'm trying to help you, but help me help you.
And you're seeing this across the board. Did you expect the increases to go this high?
Yeah, I did, because they literally, it's pretty much, it had carte blanche because of the government, the sunset of the subsidies and stuff. They're just taking advantage. People have got to understand, all these companies, United, everyone, they're stock companies. They're hired to, their job is to increase the values of the company to increase their stock prices for the shareholders. Period. They don't care about you.
Now, so what you're saying is these subsidies are hurting it's costing an increase for the businesses too.
Yeah, because so a lot of these people are promoting these Icarus, individual coverage health reimbursement arrangements. They make no sense. The premiums out of pocket's like 10,500, and it's just a game. And I'm sitting there going, use a medical expense reimbursement plan. There's flexibility. You can design it however you want, with group, with individual, with everything on it, spouses, military, whatever, Medicare. And all these people are sitting there, I don't know how these companies are going to do it. I mean, think about the one, 52%. So what are you going to say to your employees? Hi, now that instead of paying $200 every paycheck, you're going to pay $400?
Right.
Who's going to eat it?
Nobody. Yeah. I mean, I just, this is going to hurt the economy for sure if this happens. So what do you say to people in Congress right now that have made the decision? So here's the thing that's happening.
They're corrupt. That's why I said
more, give me more of a, so what I'm gonna give you an example is I literally saw basically the Democrats are saying to the Republicans, the reason why you are not going to a negotiation is because you don't want the subsidies anymore. And we know that's not the truth either. Are they going to come back and say, okay, we're going to bring back the subsidies, or you think they're dead?
No, they have to. But think about it. It's the middle class, the ones who vote, are the ones being screwed by this.
The middle class is the most getting hurt by everything that's happening right now.
Absolutely. They're being killed.
Because the middle class can't improve their paycheck to, 0.5%, maybe a year, 1% increase. And you're seeing inflation, you're seeing all these costs. Unless you have an opportunity to make more money all the time,
think about it. They're asking on the one plan, their rates are going to $4,600 a month. That pays for people's mortgage, their car, and their cottage. Why would you buy it? Why would you do that on health insurance? They have to take you at the emergency room.
But some people don't like knowing that they're not paying.
You can pay, I'll tell you what you should do. You can do direct primary care like I do. You pay them $99 a month, go there as much as you want. The blood work's reduced. The tests are reduced to a point where you don't really need insurance other than catastrophic. And then if you have to go to the hospital or whatever, if you don't have insurance, they have to take you, negotiate a plan or agree to pay X amount. They accept it every time. Why would you give away $50,000? Take that $50,000 and invest it.
So all the business owners are coming to you now, Tom, because the insurance guy says, "Oh, you have a 10% increase." When they come back to you and say, "Oh, we have a
raise," think that through. The insurance agents get a raise. The insurance companies please their stockholders, and the departments of insurance get a premium tax. They all win. So
what do you say to Congress? Oh, you said they're all corrupt. That's all you have to say.
What do I say to them?
Yeah.
You guys are living in la la land, and here's the reality. You want to fix the problem. If the government wants to be involved, it's an easy fix. I've said it time and time again. You put a $50,000 deductible on every American and you open up the market underneath. So you have competition. The savings on taxes, the stuff that's tax-free, is now going to fund the reinsurance costs to cover it all. The American public who have money don't want to blow $50,000 or pay $5,000-$6,000, take the risk. Great. They don't have to buy it. They're covered. There you go. It's a very simple solution, and you can have direct primary care doctors if you want, or you can use the others. You want to pay for that? Go for it. The insurance companies are ripping you off. The insurance agents are clueless. They're ripping you off, but they don't realize they don't even understand what they're selling. I mean, for God's sakes, I just showed a company how they could save $180,000 and have less out of pocket for their employees. And it's shown on a spreadsheet that the agent couldn't even point out because they didn't understand.
Yeah.
It's insane.
It totally is.
Yeah. So that's what's happening.
I mean, and once they saw this, how many businesses have called you that you were shocked, called you saying, what just happened?
Well, most of them they don't believe me. That's the biggest obstacle. It sounds too good to be true. And it's like, no, you're being ripped off. Here's how you're being ripped off. Do the numbers yourself. It's math. That's not emotional.
Right.
Like I've told you, you play this game called Batter Up. And the teachers, I was so quick when they do the flashcards, made me count to 3, and I still beat the kids. Those are the people now who will make decisions for companies on health insurance.
And if they can use flashcards, no, they use AI now. They say batter up at their phone and they push the button and say, here you go.
Yeah, I turn around and go, 36, 9 times 4, 36. And they go, Tom, you got to count to 3. I go. Some kids, I even give them 10 seconds, 36.
All right.
These are the people making decisions.
Schedule a call with Tom today. Go to ClaimLinx.com. And that was a special simulcast of the Neil Haley Show on the Cutting Edge Benefits Podcast, guys.